Top 7 Ways to Prevent Stroke for Those Over 60. Hello everyone, especially those of you who are over 60. Did you know that stroke is not only a serious health threat, but can also change your life forever? But the good news is, stroke can be prevented. Today I'm going to share with you 7 highly effective ways to prevent stroke that I have seen help many of my patients protect their cardiovascular health and avoid this risk. With over 20 years of experience in senior healthcare, I've witnessed many patients face strokes due to unhealthy habits and lack of information, but I've also seen inspiring stories of people who changed their lives with just a few simple adjustments to their daily routines. So how can you protect yourself? Let's explore these tips in this video. Don't forget to hit like and subscribe to the Senior Care Wellness channel for more helpful videos that will help you maintain long-term health and prevent serious health issues. Let's start the journey to better health today. 1. Control blood pressure. A crucial step to prevent stroke. As we enter our 60s, musculoskeletal and cardiovascular health become significant concerns, but there's one issue that we can't overlook: high blood pressure. This is one of the leading causes of stroke, especially in older adults. Many people don't realize that high blood pressure can damage blood vessels throughout the body, particularly in the brain, making them weak and more prone to ruptures or blockages. When this happens, the brain's oxygen and nutrient supply is disrupted, leading to a stroke. Stroke is not only a condition that causes severe damage, but can also change a person's life permanently. Therefore, managing blood pressure becomes a critical step in preventing stroke. Unfortunately, high blood pressure often doesn't show clear symptoms, leading many to be unaware of the issue until it's too late. Mrs. Helen, 73 years old, is one of my patients who had been living with high blood pressure for many years without knowing it. Her family was confused as to why she always felt tired, lacked energy, and frequently experienced headaches. When she came to see me, I recommended that she regularly monitor her blood pressure, and the results showed that her blood pressure was dangerously high. After treatment and changes to her lifestyle, her blood pressure stabilized, and her health improved significantly. She shared with me. Now I understand the importance of regularly monitoring my blood pressure. I feel much better since I truly began taking care of it. High blood pressure increases pressure on the blood vessels, making them weak and prone to damage. When blood pressure is not controlled, blood vessels in the brain may rupture or become blocked, leading to hemorrhagic stroke when blood vessels rupture, or ischemic stroke when blood vessels are blocked. This impedes the supply of oxygen and nutrients to brain cells, damaging them and resulting in a stroke. High blood pressure is not only a short-term issue, but also a hidden risk factor that may not show immediate signs. However, if left untreated, high blood pressure can lead to serious consequences in the future. To reduce the risk of stroke, the most important thing is to monitor blood pressure regularly. When your blood pressure exceeds normal levels, it increases the risk of stroke. Be sure to check your blood pressure regularly, especially if you have risk factors such as a family history of high blood pressure, being overweight, or poor health. Doctors can prescribe medications or other treatments to help stabilize blood pressure. In addition to controlling blood pressure with medication, lifestyle changes play a significant role in managing blood pressure. A healthy diet, rich in vegetables, fruits, and whole grains, naturally lowers blood pressure. You should also limit salt, sugar, and unhealthy fats. Studies show that a diet rich in calcium and magnesium, combined with a reduction in salt intake, can effectively control blood pressure. Mrs. Margaret, 69 years old, is another one of my patients who had struggled with high blood pressure for many years. After she adopted a healthy diet and increased physical activity, her blood pressure significantly decreased. I didn't expect that eating healthy and walking every day would help me control my blood pressure so well, she shared. Now I feel more confident about my health and no longer worry about the risk of stroke. Regular exercise is also a great way to lower blood pressure and improve cardiovascular health. Activities like walking, swimming, or yoga not only help reduce blood pressure but also make the body stronger and more energetic. An important factor to keep in mind is managing stress. Chronic stress can raise blood pressure by prompting the body to release hormones like adrenaline and cortisol. These hormones increase heart rate and blood pressure, contributing to the damage of blood vessels. Finding ways to reduce stress every day through relaxation methods like meditation, deep breathing, or listening to calming music will help maintain stable blood pressure and reduce the risk of serious health problems. Managing blood pressure is one of the most crucial steps in preventing stroke. Especially for older adults, regularly monitoring blood pressure and following your doctor's treatment guidelines is essential to minimize risk. Change your lifestyle from diet to stress management and maintain a healthy routine to protect your cardiovascular health and prevent stroke. If you haven't been monitoring your blood pressure, don't wait for severe symptoms. Start today and make small changes in your life to protect your health. 2. Maintaining a healthy diet. An effective way to prevent stroke. A healthy diet plays an extremely important role in preventing stroke, especially for older adults. As we reach the age of 60, our bodies begin to undergo many changes which increase the risk of cardiovascular issues, high blood pressure, and stroke. A well-balanced diet rich in essential nutrients can help us control blood pressure, improve cardiovascular health, and reduce the risk of stroke. Let's imagine Mrs. Susan, 69 years old, who had lived with high blood pressure for many years without realizing how dangerous it was. She frequently ate processed foods, fast food, and consumed very few fruits or vegetables. She felt fatigued, and her blood pressure was consistently high. After she began to change her eating habits, she increased her intake of fruits, vegetables, and whole grains while cutting down on salt and saturated fats. She noticed significant improvements in her health. Her blood pressure began to stabilize and she felt much more energetic, no longer suffering from frequent headaches or prolonged fatigue. A healthy diet not only helped Mrs. Susan control her blood pressure, but also reduced her risk of cardiovascular diseases and stroke. Foods rich in vitamins, antioxidants, and fiber such as green vegetables and fruits play a crucial role in protecting blood vessels, reducing inflammation, and lowering bad cholesterol levels in the body. These foods help strengthen heart health and reduce the risk of plaque buildup in the arteries, which is the cause of atherosclerosis and stroke. An important factor in a healthy diet is adding whole grains to every meal. Oats, brown rice, quinoa, and barley are excellent sources of fiber, helping reduce bad cholesterol LDL in the blood and maintain stable blood pressure. Fiber also supports the digestive system, boosts the immune system, and reduces the risk of cardiovascular diseases and stroke. These foods not only help control cholesterol, but also keep blood vessels healthy and flexible, reducing the risk of cardiovascular diseases. Mrs. Susan also shared that one of the significant changes that improved her health was reducing salt in her daily diet. Previously, she consumed a lot of processed foods that were high in salt. After reducing salt, her blood pressure became more stable, and she felt lighter and much healthier. Reducing salt helps lower blood pressure and improve heart health. When you eat less salt, you also help the circulatory system work more efficiently, reducing the risk of blood clots and high blood pressure, major risk factors for stroke. In addition to dietary changes, supplementing with omega-3 is essential for reducing stroke risk. Foods like salmon, chia seeds, flax seeds, and olive oil are excellent sources of omega-3, which helps reduce inflammation, lower blood pressure, and protect blood vessels from blockages. Omega-3 has a protective effect on the heart and blood vessels, preventing atherosclerosis, while reducing inflammation in the body, thus lowering the risk of blood clots, which are a direct cause of stroke. Another important change Mrs. Susan made was increasing her intake of vitamin C-rich foods like oranges, strawberries, and kiwi. Vitamin C helps boost immunity and improve blood vessel health, reducing the risk of atherosclerosis and maintaining a healthy heart. Vitamin C also has anti-inflammatory effects and helps improve blood circulation, which is a key factor in reducing the risk of stroke. Another factor Mrs. Susan shared was reducing her consumption of processed and fast foods. These foods are often high in unhealthy fats and salt, increasing cholesterol and blood pressure, thereby raising the risk of heart disease and stroke. She said, "I used to eat fast food frequently, but now I've learned to cook at home with fresh, clean ingredients. I feel much healthier and no longer worry about high blood pressure. A healthy diet not only helps control blood pressure, but also supports heart health, reduces the risk of atherosclerosis, and protects blood vessels from damage. Especially for older adults, making small changes in diet can yield remarkable results, as Mrs. Susan experienced. These changes not only helped her minimize stroke risk, but also allowed her to live a healthy, energetic life while reducing health problems. So if you haven't started changing your diet yet, start today. Increase your intake of vegetables, fruits, whole grains, and healthy fats in every meal to effectively maintain cardiovascular health and prevent stroke. 3. Regular exercise. An effective way to reduce stroke risk. As we reach our 60s, we begin to face inevitable changes in our bodies. One of the most important things we can do to protect our health and reduce the risk of stroke is to maintain an active lifestyle, especially through regular exercise. Numerous studies have shown that engaging in physical activity for at least 30 minutes a day can significantly reduce the risk of stroke. Health experts have pointed out that exercise helps maintain a healthy heart, lower blood pressure, and improve blood circulation, all of which contribute to protecting blood vessels from damage, especially in the brain, where strokes often occur when blood vessels become blocked or ruptured. The benefits of exercise not only improve heart health, but also reduce inflammation, helping the body maintain a strong circulatory system and lowering the risk of blood clots. When we exercise, especially with moderate physical activities like walking, swimming, or cycling, we activate the circulatory system. This not only helps improve heart rate, but also ensures blood flows more quickly through the blood vessels, including those in the brain. This helps reduce blood pressure and makes the blood vessels more flexible, improving blood circulation and reducing vessel blockages. When blood vessels are kept healthy, the risk of atherosclerosis and stroke is greatly minimized. A large study conducted by the World Health Organization (WHO) showed that individuals who engage in at least 150 minutes of exercise per week can reduce their stroke risk by up to 30%. Furthermore, regular exercise helps maintain stable blood pressure, lower bad cholesterol (LDL), and increase good cholesterol (HDL), which in turn reduces inflammation in the body, an important factor in preventing stroke. One of the greatest benefits of regular exercise is improving blood circulation. When you move, your heart needs to pump blood faster, delivering oxygen and nutrients to cells in the body, especially the brain, where strokes commonly occur when the brain does not receive enough blood. Blood vessels become more flexible and stronger, reducing the risk of blockages, the main cause of ischemic strokes. Additionally, improving blood circulation helps protect the nervous system and maintain better brain function. When we exercise, the body enhances blood circulation, helping reduce the risk of blood clots and lower high blood pressure. This is a crucial factor since high blood pressure is one of the leading causes of stroke. By maintaining stable blood pressure, the risk of stroke due to high blood pressure significantly decreases. The great thing about exercise is that you don't need to engage in high-intensity workouts. Even light activities can have huge benefits for the health of older adults. One of the simplest and most effective exercises is walking. You don't need to walk fast or for long periods. Just 20-30 minutes a day can help improve blood pressure, strengthen heart health, and enhance blood circulation. In addition to walking, other gentle exercises such as yoga, tai chi, or light cycling are ideal options. These exercises not only improve flexibility, reduce stress, but also help maintain the health of vital organs in the body, including the heart, blood vessels, and brain. More importantly, regular exercise helps prevent diseases, reduce stroke risk, and enhance mental health. Regular exercise is one of the simplest yet most effective methods to reduce stroke risk. Exercising for 30 minutes each day can improve blood circulation, lower blood pressure, and help protect blood vessels in the body, especially the brain. This is a simple action that has a significant impact on protecting cardiovascular health and preventing stroke. So don't wait any longer. Start today and maintain a gentle, regular exercise routine to protect your health. 4. Controlling cholesterol. The key to reducing stroke risk. As we enter our 60s, controlling cholesterol is not just a recommendation, but a necessary step to protect our health, particularly in preventing stroke. High cholesterol, especially bad cholesterol LDL, can lead to plaque buildup in blood vessels, causing blockages that reduce blood flow to organs, particularly the brain, leading to a stroke. Therefore, controlling cholesterol is one of the crucial steps to protect blood vessels and reduce the risk of stroke. I remember one of my patients, Mr. Tom, 68 years old. When he came to see me, he was very concerned, as he had started showing signs of high blood pressure and frequently felt fatigued. After a checkup, I discovered that his LDL cholesterol levels were higher than normal, and he was at a high risk of vascular blockages. He had a family history of heart disease and stroke, so I explained to him that controlling cholesterol was extremely important to reduce this risk. I advised him to start changing his diet, reduce saturated fats, increase omega-3 rich foods like salmon, chia seeds, and flax seeds, and begin gentle daily exercise. At first, Mr. Tom found it a bit difficult to change many of his eating habits, but after a few weeks he came back and shared with me that he felt much healthier. His blood pressure had decreased significantly, he felt more energetic, and his chest pain had disappeared. He proudly told me, "I can't believe that with just a few small changes in my diet and regular exercise, I feel healthier than ever. I no longer worry about high blood pressure or the risk of stroke." Cholesterol, especially bad cholesterol LDL, can accumulate in blood vessels, leading to atherosclerosis. When plaque forms, it narrows blood vessels, restricting blood and oxygen flow to organs, especially the brain. If part of the plaque breaks off, it can cause a blood clot, blocking the blood flow to the brain and leading to a stroke. High cholesterol not only causes blockages in blood vessels, but also reduces the flexibility of blood vessels, leading to high blood pressure, another significant risk factor for stroke. To control bad cholesterol and increase good cholesterol HDL, we need to change our diet and lifestyle. Reducing saturated fats and bad cholesterol in food is the first step. Foods like red meat, butter, and full-fat dairy can increase LDL. Instead of these, choose unsaturated fats, like olive oil, chia seeds, flax seeds, and salmon. Omega-3s in these foods not only reduce LDL but also help protect blood vessels and improve heart health. In addition, adding fiber to your diet is also an effective way to lower cholesterol. Foods like oats, whole grains, leafy greens, and fruits provide fiber that helps reduce LDL in the body. Fiber binds to bad cholesterol and helps eliminate it through the digestive system, thus reducing cholesterol levels in the blood. Not only diet, but regular exercise also plays a crucial role in reducing bad cholesterol LDL and increasing good cholesterol HDL. Exercise increases heart rate, improving blood circulation and lowering blood pressure. Additionally, scientific studies have shown that exercising for 30 minutes a day can lower bad cholesterol, increase good cholesterol, and reduce stroke risk. Controlling cholesterol is a key step in reducing the risk of stroke. By changing your diet, adding healthy foods, reducing bad cholesterol, and increasing good cholesterol, along with maintaining regular exercise habits, you can reduce your risk of stroke. This will not only help protect heart health, but also enable you to live a healthy and active life. Start making changes today to protect your heart and long-term health. 5. Quit smoking and limit alcohol. Important measures to reduce stroke risk. In my experience of caring for elderly patients, one of the most important factors I always emphasize is quitting smoking and limiting alcohol. Both smoking and alcohol are major risk factors for cardiovascular health and blood vessels, especially for older adults. These habits not only increase blood pressure but also damage blood vessels and reduce blood circulation to vital organs, including the brain. These effects are one of the main causes of stroke. I remember one of my patients, Mr. William, 70 years old, who had been smoking for over 40 years and drank alcohol almost every day. He often experienced shortness of breath, fatigue, and chest pain. After a checkup, I discovered that his blood pressure was high, his LDL cholesterol levels were very elevated, and his blood vessels were gradually being damaged. He shared that he had tried to quit smoking many times, but had not been successful, and didn't believe he could live healthily without continuing to drink alcohol. However, after I explained to him that smoking and alcohol were the primary factors putting him at risk for stroke and heart disease, he decided to make lifestyle changes. Smoking is one of the most harmful habits for blood vessels and cardiovascular health. When you smoke, the chemicals in the smoke damage blood vessels, making them rigid and narrow. This reduces blood flow, increases blood pressure, and increases the risk of blood clots. These blood clots can travel to the brain and cause ischemic stroke, where part of the brain does not receive enough oxygen and nutrients. Moreover, nicotine in cigarettes raises blood pressure and stimulates the sympathetic nervous system, causing the heart to work harder. It also causes blood vessels to constrict, reducing blood flow and increasing the risk of stroke. Alcohol is also a significant factor to control in preventing stroke. While moderate alcohol consumption may benefit heart health, excessive drinking can increase blood pressure, cause arrhythmias, and damage blood vessels. Drinking too much alcohol can also raise triglyceride levels, leading to atherosclerosis and blood vessel blockages. When blood vessels are damaged and can't function properly, strokes are more likely to occur. Additionally, alcohol increases the risk of hemorrhagic stroke, a more dangerous type of stroke as it thins the blood and causes bleeding in the brain. Excessive drinking can also lead to obesity, another risk factor for high blood pressure and stroke. When we quit smoking, blood vessels begin to heal, and circulation improves. A study published by the American Heart Association showed that just 1 year after quitting smoking, the risk of heart disease and stroke is reduced by 50%. Quitting smoking not only helps lower blood pressure, but also reduces the formation of blood clots, thus lowering stroke risk. As for limiting alcohol consumption, studies show that reducing alcohol intake can significantly improve blood pressure and cardiovascular health. A study from Harvard University found that individuals who reduce their alcohol consumption tend to have more stable blood pressure, lower obesity risk, and thus lower stroke risk. When you quit smoking and limit alcohol, you not only protect your heart health, but also reduce the risk of other serious diseases, such as lung cancer, liver disease, and diabetes. This means you are protecting your body from the risk factors of stroke. Mr. William noticed significant improvements after quitting smoking and limiting alcohol. With just small lifestyle changes, he felt healthier, more relaxed, and most importantly, his stroke risk decreased. Quitting smoking and limiting alcohol is one of the most important steps in reducing stroke risk and protecting cardiovascular health. Scientific studies have proven that when we eliminate these habits, blood pressure stabilizes, blood vessels become healthier, and stroke risk is significantly reduced. Don't wait any longer. Make these changes today to live a healthier, more energetic life and effectively prevent stroke. 6. Stress management, the key to reducing stroke risk. Stress is an inevitable part of life, but as we age, the effects of prolonged stress on the body become more pronounced. Not only does stress affect mental health, but it can also increase the risk of cardiovascular diseases and stroke. When you experience stress, your body releases stress hormones like adrenaline and cortisol, which can raise blood pressure, increase heart rate, and make the body more tense, creating a negative chain reaction that can lead to a stroke. I remember one of my patients, Mrs. Helen, 66 years old, who was always anxious about work and family relationships. She shared that she couldn't stop thinking about personal and work issues, which made her feel exhausted and drained. Her blood pressure was often high, and she had already suffered a mild stroke before coming to see me. During our conversation, I noticed that one of the main factors contributing to her stroke risk was the level of stress she faced daily. She didn't realize that managing stress properly could help reduce its negative effects on her cardiovascular health. I guided her to practice meditation and deep breathing to relieve stress, and I also encouraged her to join gentle yoga classes each morning. After a while, she came back for a follow-up and shared that she felt much more relaxed, her blood pressure had stabilized, and she no longer felt as anxious as before. She enthusiastically told me I didn't realize that such small changes could help me feel so calm and much healthier. Prolonged stress can have serious effects on our nervous and cardiovascular systems. When the body produces adrenaline and cortisol, blood pressure can spike, and heart rate can increase. This creates a fight or flight response that the body cannot sustain long-term without harm. When blood pressure becomes too high, the blood vessels experience great pressure, and over time they can become damaged, leading to atherosclerosis and blood vessel blockages. Chronic high blood pressure is one of the primary causes of stroke. Additionally, cortisol can raise blood sugar levels, increasing the risk of diabetes, another stroke risk factor. Moreover, stress can lead to unhealthy eating habits, consuming too much sugar and fat, which in turn raises cholesterol and blood pressure. Fortunately, there are several effective relaxation methods that can help reduce stress, lower blood pressure, and protect cardiovascular health. One of the simplest ways is meditation. Studies have shown that meditation can reduce cortisol levels, help the body return to a relaxed state, lower blood pressure, and improve blood circulation. Just spending 10-15 minutes daily meditating or practicing deep breathing can significantly improve mental health and reduce stress. Yoga is also a great method for relaxing both the body and mind. The stretching movements in yoga not only help improve flexibility, but also reduce body aches, relieve mental stress, and enhance blood circulation. Studies have shown that yoga can help lower blood pressure, reduce inflammation, and improve heart health, thereby reducing the risk of stroke. In addition to meditation and yoga, engaging in relaxing activities such as reading, listening to music, or spending time on personal hobbies can also help reduce stress. A gentle walk in the park or sitting in the sun for meditation are also great ways to relax, helping to calm the mind and restore the body. When we face stress, the body produces cortisol to help us deal with stressful situations. However, when stress is prolonged, high levels of cortisol can harm our health by raising blood pressure, increasing heart rate, and weakening the immune system. Studies have shown that managing stress through meditation, yoga, and relaxation techniques can reduce cortisol levels, lower blood pressure, and decrease the risk of stroke. A study published in the Journal of Hypertension showed that yoga can help reduce blood pressure in people with high blood pressure. Another study from Harvard Medical School showed that meditation helps reduce psychological stress, lower cortisol levels, and thus decrease the risk of cardiovascular diseases and stroke. Chronic stress can have severe effects on cardiovascular health and increase the risk of stroke. However, managing stress through methods like meditation, deep breathing, yoga, or simply spending time on personal hobbies can help reduce stress, stabilize blood pressure, and protect cardiovascular health. By spending a little time each day relaxing, you can improve both your mental and physical health while reducing the risk of stroke. 7. Regular health checkups. The key to preventing stroke. As we enter our 60s, maintaining health is not just a concern, it becomes a necessary habit. One of the most important and effective ways to reduce the risk of stroke is through regular health checkups. These checkups help detect early potential issues like high blood pressure, high cholesterol, or diabetes, all of which are major risk factors for stroke. Through early detection, we can intervene and minimize serious risks to cardiovascular health. I remember one of my patients, Mr. Charles, 69 years old, who had not undergone regular health checkups for many years. He felt healthy, only experiencing minor issues like fatigue, or occasionally feeling dizzy when standing up. However, after I advised him to undergo regular health checks, the results showed that his blood pressure was high, and his LDL cholesterol, bad cholesterol, was dangerously elevated. This surprised him, as he didn't have clear symptoms. Thanks to early detection, he started adjusting his diet, reducing salt and fats, and increasing regular exercise. After a few months, his health improved significantly. He shared, "I didn't think I could prevent the risk of stroke just by making simple lifestyle changes. Now I feel healthier, and I'm no longer worried about my cardiovascular health." Regular health checkups are the first step in identifying potential health problems, allowing you to be proactive in preventing diseases, especially strokes. Issues like high blood pressure, high cholesterol, and diabetes often don't show clear symptoms in the early stages, but they are major risk factors for strokes. Early detection of these issues allows you to intervene and receive timely treatment, reducing the risk of stroke in the future. One of the most important checkups is blood pressure monitoring. High blood pressure is the leading risk factor for stroke, and it often has no symptoms in the early stages. If left unchecked, blood vessels in the body, particularly in the brain, can become damaged, leading to stroke. Therefore, it is crucial to regularly check and closely monitor blood pressure. Checking cholesterol is equally important. High cholesterol, especially LDL cholesterol, bad cholesterol, can accumulate in the blood vessels, causing atherosclerosis and blood clots, significantly increasing the risk of stroke. Monitoring cholesterol helps you understand the condition of your blood vessels and allows for dietary or medicinal interventions if necessary. Additionally, checking blood sugar levels is essential. Diabetes is another risk factor for stroke, as high blood sugar can damage blood vessels and nerves, especially in the brain. Blood sugar tests help detect diabetes early and allow you to adjust eating and lifestyle habits accordingly. Scientific studies have proven that regular health checkups can help reduce the risk of stroke and cardiovascular diseases. A study conducted by the American Heart Association found that those who regularly monitor blood pressure, cholesterol, and blood sugar have a lower risk of stroke compared to those who do not. Early detection of risk factors allows for timely intervention, which minimizes damage to the blood vessels, protecting cardiovascular health and reducing the risk of stroke. Regular health checkups also help doctors detect early signs of pre-stroke conditions, such as high blood pressure, lipid disorders, or diabetes, which allows for timely preventive measures. This not only reduces stroke mortality rates, but also improves the quality of life for patients in the future. Regular health checkups are essential for stroke prevention. Monitoring blood pressure, cholesterol, blood sugar, and cholesterol levels helps detect early potential problems, enabling you to be proactive in adjusting your lifestyle and preventing stroke. Don't wait until symptoms appear. Start scheduling regular health checkups today to protect your future health. Advice from Dr. Ryan Davis. Stroke is a serious health issue, but it is not inevitable. In fact, with simple lifestyle changes, a healthy diet, and regular exercise, we can protect our health and significantly reduce the risk of stroke. Small actions like controlling blood pressure, having regular cholesterol checks, reducing stress, and quitting smoking can make a big difference in safeguarding cardiovascular health and blood vessels. Both I and many other experts agree that being proactive about lifestyle changes will not only help you live longer, but also help you live healthier. Starting small changes today, like eating more greens, nuts, and increasing physical activity, will help you build a strong health foundation for the years ahead. If you found this video helpful, don't forget to like and subscribe to our Senior Care Wellness channel for more useful videos on how to care for the health of older adults. Share this video with your family and friends so they can also protect their health and effectively prevent strokes. Start making changes today, because your health and the health of your loved ones are the most valuable things.